Have you ever imagined how the situation of Malaysia in 2050? Are we in a good condition, or maybe we are surviving so hard to live? In 2050, government hope that Malaysia is a top 20 country in the world under the 2050 National Transformation Initiative. I found an article about the possible ugly truth for the country where the population is old, poor, sick, and without children. I am interested to share the fact and forecast of the future Malaysian in 2050. What influenced the increasing of the Malaysian in 2050? What happened to young and elder generation in 2050? So, I will share about the reason of increasing Malaysian in 2050. Let's talk about the first reason, which is the advance in health and safety in Malaysia. The advance in health and safety areas have led to a drastic increase in human lifespan and the increasing older age people living than in the past. According to the prediction from Analytics Malaysia Chief Economist Dr. Muhammad Abdul Khalid, the population increasing to be 40 millions in 2050. Based on the Department of Statistics Malaysia, the population in 2020 is estimated at 32.7 million as compared in 2019, the population is 32.5 million. The Malaysian healthcare system is advanced due to extensive support from the Malaysian government through investment in hospitals, medical infrastructure. The improvement in the last 10 years are significant enough to be on par with the well-developed countries comprising of both well-trained medical staff and excellent hospitality facilities. So, the advancement of the healthcare system in Malaysia lead to increase the number of older people in future. So, the next reasons that influence the Malaysians population in 2050 is the decreasing rate of fertility in Malaysia. The decreasing of children population in Malaysia in 2050. According to the Department of Statistics Malaysia, the rate of children per woman has been decreased to 1.9 children. The forecast show the population in Malaysia will grow to 40.7 million in 2050. But the population of children under 18 will fall to 8.344 million in 2050 from 9.056 million currently. This shows the population of young people become lower than recent times. The young generation helps a lot in shaping the future Malaysia. In recent times, the decreasing of fertility rate along the developed countries, for example, Australia, United Kingdom with 1.8 children, Canada 1.5 children, Singapore 1.2 children, and South Korea 1.1 children. The trend of decrease of fertility rate influenced Malaysian people. Most of the couple usually wanted to have 1 to 2 children because of career, education, and lifestyle. The modern lifestyle influenced the fertility rate in Malaysia. Nowadays, most of the young parents have their own career. Based on the theory from Richard Esterling, 1987, the low fertility rates will give the parent less competition in job market. That means that they will have a good wage and fast career advancement. In contrast, the person who have a lot of children will face less favorable economic situation. In demographic factors, improvement made in the provision of healthcare service and decrease in infant mortality rates have significantly reduced fertility rates. In socio-economic factor, increase in income, education enrollment of females and female employment influence the fertility rates in Malaysia. The decision to have children is related to the size of family they want. The couples are able to decide whether to have children, when to start, and the space between the children. So, this gives impact to the fertility rates in Malaysia. Next, the last reason is less job opportunities for elder people. The increasing of elder age people has less job opportunities to make them hard to move out of poverty. The aging society has less job opportunities in future. As the financial sector grows, so does the level of demand. Therefore, the price of goods and service will also go up. Unfortunately, wage and salaries do not rise as fast as the price of goods. Dr. Muhammad said that males between age 65 to 69, 1 in 3 will still be working. The age 70s and above, 1 in 5 will still be working, and this rate will increase in 2050. The old age and the health condition of elder age people will make them difficult to get the job. In current time, there are about 70% of Malaysians withdraw their money from the employees' provident fund. Most of their saving with less than 50,000 ringgit Malaysia, and about 20% of Malaysians having less than 7,000 ringgit Malaysia. Even the young people in 2050 is hard to survive. Youth employment is going up in future. Even having a job, but the salary probably going to be no improvement. We can see in between 2007 and 2015, the job wage growth for graduates was only 2%. Minus inflation, the wage growth become negative. We can see in future, if the elder people in 2050 have no saving, this will make them harder to survive in the future. The young people also will struggling to survive with the low wage but the high cost of living. The other side of the advancement of health system, it also costs them a lot of money to get treatment. Whether we are aware or not, that Malaysia is one of the countries in Southeast Asia with the highest obesity in smoking people. 1 in 5 Malaysians are smokers, while 7 in 10 are second-hand smokers. Meanwhile, rate of diabetic people in Malaysia also increased. The hypertension and mental health problem also increased, with 1 in 3 people have it. The rising of cost of living make them hard to survive in 2050. They might be old and sick. Even the government will provide free treatment, but how long does the government could sustain if there are a large number of elder people who sick? We can see from the Japan, they are having financial problems. The financial problems have made Japan reluctant to fund medical care of the elderly a few years ago. One of its minister called on the elderly not to come to the hospital but asked to stay at home until death. I think this is a serious issue that needs enough attention. The entire structure of the economy and ideology has to change. It is not just a specific policy and intervention is required, but the whole ideology. The focus on being top 20 high-income country is pointless. It does not mean and help anything if it only helps certain groups only. The government should focus more on the growth in Malaysia. I hope that government will help the Malaysia with a new policies and strategies to make sure this will not happen in future 2050. We only have 30 years more to meet 2050. I will end my speech by quoting an advice from Mahatma Gandhi. The future depends on what we do in the present. Thank you.